Hi, it's Dr. G, Specialist Medical Doctor and PhD in Midlife Women's Hormones. And today I'm talking about low progesterone again in midlife and perimenopause, and today particularly on progesterone cream. And I do mention this a lot in section 3 of my new book. So, is progesterone cream recommended for low progesterone symptoms in midlife and perimenopause? Generally, it isn't by many of the menopause societies and GP protocols, etc., because there's 3 reasons. The first is that there's barely been research into low progesterone symptoms to help validate the connection between having symptoms and low progesterone. The second reason is that in the past, when progesterone has been applied to the skin as a cream or as a gel, but the gel isn't as common and is a little different, when it's applied as a cream, it barely raises the blood levels of progesterone. So it's been assumed that progesterone cream doesn't get into the body, so it can't work. That's an assumption which I don't think is true. And there is literature to suggest that progesterone cream delivers the progesterone into the fat tissue under the skin and directly into the tissues. So it actually increases the blood levels in the capillaries, that's like a blood spot, and it increases the levels in saliva. So that assumption that it doesn't get in and therefore it can't work is probably not true. And the third reason is that because there's no TGA or FDA or EUA or the UK version approved pharmaceutical product, so many people would not prescribe it because it's needed as a script is needed and a compounding pharmacist is needed to make it up. There are some commercially available products online, but they're not recognised pharmacies and they're not compounded pharmacies. So there are 3 main reasons why it isn't recommended, but why it's probably a false assumption that progesterone cream doesn't get into the body. I use it in my practice for low progesterone symptoms in midlife and perimenopause, and I can tell you it must be working, and it is working way better than what I would think a placebo would be working. So I want to give you the opportunity to ask anything or general questions about progesterone cream in the comments, and next week I'll talk a little bit more about the cream, how long you might want to stay on a cream for, and how to use it in general, before we'll move on then to the uses of oral progesterone. Okay, we'll see you next time.